In this lecture, I am going to talk about complement deficiency disorders, paroxysmal nocturnal hemoglobinuria, and this result from deficiency of decay accelerating factor, which is anchor to many white blood cells. And as can be seen here, the decay accelerating factor, it plays very crucial role in protecting the nearby or the host cell when the immune response is done, as it interferes with binding of C4b to C2b, as can be seen here. And also the early components of the classical pathway of the complement C1q, C1r, C1s, C4, and C2. So deficiency in these will lead to immune complexes disorders, for example, systemic lupus, erythematosus, glomerulonephritis, vasculitis, and also patient with deficiency of this component may come with recurrent streptococcal and staphylococcal infection, and deficiency of C1 inhibitory factor will lead to what is so-called hereditary angioedema. So the patient will come with swollen lips and swollen throat and maybe suffocation and needs fast and rapid intervention. So deficiencies in factor D and proper D will lead to recurrent Neisseria infection. And factor D is important for cleavage of or activation of factor B, and as it cleaves into BA and BB, BB will bind to spontaneously cleave C3b, and this will lead to formation of C3 convertase, which is necessary for the remaining of the pathway. Proper D is very important for the stability or stabilization of C3b and BB, as it is unstable. So deficiencies in these two factors will lead to recurrent Neisseria infections. Deficiency in complement component number 3. This is a central component in both classical and the alternative pathway. So it will lead to serious diseases or serious disorders. Usually the patient is a child or children, and they present with recurrent bacterial infections and may develop immune complexes disorder in the future. So membrane attack complex, which is formed or starts from C5, 6, 7, 8, and 9. And as can be seen here, it is responsible for removing of phospholipids, and this will lead of holes or pores, and fluids, they come from inside and enter the cell, and the cell, this will lead to disruption of the osmolarity, and the cell get swollen and rupture. But however, when the immune system done this patient deficient, this should be stopped by some mechanisms. So patients with membrane attack complex deficiency may present with recurrent meningococcal and gonococcal infection caused by Neisseria infection. Thank you very much, Professor Ahmed Bolad.